Happy noon, everyone. Thank you for joining us. Just wanted to get started with some of the best practices of Zoom these days. As a courtesy for our presenter, we ask that you keep yourself on mute during the presentation, but please keep your video on because we would love to see you. We miss seeing you, but if you can't, we understand. We are here to present the most popular topic in my industry is the new emergency implementation of the Emergency Temporary Standard through OSHA. And I don't know about you guys, but if you try to comb through that, it was a little confusing. So we figured we find the industry expert to help simplify some of what's in there so we can, as managers, be able to implement what's required from us. So it is my great pleasure to introduce Malek Alaouie, who is a certified indoor environmentalist with over 13 years of experience in infection prevention and control, indoor air quality, and operations management. Malek holds Bachelor's of Science in Biology. He also has his MBA and is currently a PhD candidate for environmental health. During the presentation, as questions come up, we encourage you to chat them in the chat feature, and Malek and I will address all the questions toward the end of the presentation. We promise we will not forget. Take it away, Malek.
Right. Thank you, Sonia. Hello, everybody. Actually, before we start, it's another day, another regulation, right? So we want to establish the definition of the work environment. When we understand what the work environment is, we can assume relatedness to work-related injuries and illnesses. So according to the definition of Title 8, Section 14300.5, work environment is any establishment or other locations where one or more employees are working or are present as a condition of their employment. It includes not only physical locations, but equipment and materials used by the employee during the course of their work. So if you have an employee performing a task outside the office and anything occurs, an incident, a reportable and recordable incident, it is considered as work related. Moving on, we're gonna go over the Emergency Temporary Standard. We're gonna refer to this as ETS throughout the webinar. We're gonna cover the section, the 5 new sections under the standard covering COVID-19 prevention, COVID-19 infections and outbreaks, prevention in employer-provided housing and transportation, and we're gonna focus on site risk assessment, is what industrial hygienists like myself and my colleagues have been doing for the past year or so during COVID. And of course, by the end of the webinar, you're welcome to ask questions, as Sonia mentioned. So the Emergency Temporary Standard went in effect on November 30th, 2020. It is set to expire on October 2nd, 2021, and it can be subject, to 2 90 days extensions. There are 5 new sections under this standard. So if you've been to take a trip to the OSHA website and you lose your way, just to let you know that here where you can find the new sections. So it falls within the same subchapter as your injury and illness prevention program. So the IIP is section 3203. The COVID prevention section is 3205. The first section is COVID prevention. It applies to all employees and places of employment, for the exception of employees who work alone in a place and do not interact with people. Employees who work from home. But let me tell you something. So this applies to COVID. But if you had someone working from home and they had an injury or illness related to the task they were performing, that's a reportable or recordable task. But for COVID, specifically for this program, it doesn't apply. And employees who are covered under section 5199, which is aerosol transmissible diseases, also doesn't apply. This section is covered under healthcare and any location where they perform aerosol generating procedures. This section highlights few definitions. We're not gonna go over every single definition because you're well familiar, with most of these terms. COVID-19 case is any case who tests positive or dies due to COVID or is subject to an order of isolation by a local health department. COVID exposure is being exposed to a COVID-19 case within 6 feet for a cumulative of 15 minutes or over 24 hours period. A COVID-19 hazard is being exposed to infectious particles or surfaces who are contaminated with a virus. You're all well familiar with the symptoms, but to list some of those symptoms, they include, but not limited to, fever, difficulty breathing, body ache, headaches, sore throat, nausea, vomiting, and new loss of taste or smell. A COVID-19 test is a viral test, which is approved by the FDA, and an exposed workplace. So you have to understand that the workplace is not necessarily the whole work environment. So you can have micro work environments inside, the work environment. And the benefit of establishing that is if you cohort some of your employees and then you have an outbreak at one of the workplaces, you're not isolating and quarantining the whole building. So if you can justify and confirm that this outbreak occurred at that particular workplace as defined by workplace definition, then you are only treating that particular section of your building. You all well know what face covering is. The high-risk exposure period is very important to understand. So it is for you have symptomatic and asymptomatic individuals. For individuals who show symptoms, the high exposure period starts from 2 days before their symptoms started and ends 10 days, after their symptoms. When 24 hours have passed, between day 9 or day 10, for example, with no fever and without the use of fever-reducing medication, and the symptoms have improved. For asymptomatic individuals who do not show symptoms, but they test positive, it'll be 2 days before their specimen collection date until 10 days have passed. Under this section, every employer is required to have and maintain a COVID-19 prevention program, CPP. Now you have the option to integrate that into your current injury and illness prevention program or maintain it as a separate document. The advantage and benefit of maintaining this as a separate document is when OSHA is conducting an audit and they want to cite this document, they cite only the CPP rather than the whole IIPP program. And then if there are any new regulations or emergency standards, then you are actually only updating the CPP and not the IIPP. So the requirements under the CPP are, first of all, communication. You have to encourage employees to report any symptoms. Some employers encourage whistleblowing. And what we mean by whistleblowing is that if they spot any violation on site, any task that may make them more susceptible to infection, they have to report that task without fear of reprisal. Every employer must describe the procedures and policies for accommodating those employees who are at a higher risk, those employees who are compromised, immunosuppressed, or have underlying medical conditions that may make them prone to the infection. The employer must also provide information regarding the benefit and how to access COVID-19 testing. And most employers work with different stakeholders, with vendors, visitors. So you must communicate your internal COVID-19 policies and procedure to anyone you are working with, anyone who will access your building. The second requirement is identifying and evaluating the COVID-19 hazard. Now, your employees are more familiar with the task they're performing and more familiar with the environment they work in. So they may be able to spot a COVID-19 hazard or a task or a deficiency in the task they are performing that make them susceptible to the infection. When you involve staff and employees in identifying and evaluating the environment, you are reassuring them that you are trying your best to make the work safe, the work environment safer for them to come back to work. you must demonstrate that there are some infection prevention efforts performed during the working hours by implementing screening policies. So this starts at the household or at the facility, and it can be performed throughout the day if you have a certain location in your facility where you believe that this location, this microenvironment or workplace is at a higher risk of an outbreak because the tasks require people to work within 6 feet from each other. You should also demonstrate that you have effective and immediate response to COVID-19 cases at the workplace. So after the screening has passed, if anyone develops symptoms on site, then you have to show what are the steps to isolate that individual from and shield the other. So there's isolation and shielding. So when you shield, you're protecting people. When you're isolating, you're taking away the hazard from other people. So you have to demonstrate how you are accommodating for infected individuals or individuals who develop symptoms until transportation has been secured. One important requirement is conducting a site-specific hazard assessment and ventilation evaluation. So these two items will be discussed more details toward the end of the webinar. It's part of what we do as industrial hygienists. Every employer must be familiar with local health department orders and industry-specific guidance. So OSHA had generated a bunch of documents which are industry-specific. So every industry has a guidance document and a supplemental checklist. So if you go to your industry-specific industry, you can download the requirements. What are the measures that must be taken for safe reopening? And then you have the checklist document to go over implementing those different measures. There must be constant evaluation of the current controls in place. And this is something required when you have an outbreak to see what corrective measures must be taken to remove the hazard. This can be performed by conducting periodic inspections as a preventive method, and not a proactive and not reactive method for reducing the hazard. So conducting periodic inspections to ensure compliance with employers' COVID-19 policies and procedures. Usually what we advise is every employer establish a hierarchy of controls or responsibilities. So we usually have the risk management work hand in hand with HR, and they appoint a COVID-19 safety coordinator. The safety coordinator can have different roles and responsibilities. One of them is to perform the inspections. You can either assign this role to a department head or any supervisor, and then they will also help with when you perform contact tracing in the event of a COVID-19 case and exposure on site. You must demonstrate effective procedure to investigate COVID-19 cases in the workplace, as we discussed, and this is done through proper contact tracing. When we've seen a lot of clients, integrate a lot of new softwares and tools to conduct proper contact tracing, starting from reporting your symptoms at home. And when you access the building or the work location, you can record all the locations that you'll be visiting. This can be done for employees, staff members, and visitors and vendors who come to your building. The contact tracing tool will help you assess who may have been exposed to the COVID-19 case, if it falls under the COVID-19 exposure definition, and then you'll be able to notify that person about their possible exposure, so they may quarantine and monitor their symptoms. So and then you can advise testing and the benefit of testing, and look at what may have contributed to the outbreak. If you have a large and unusual number of cases due to a single outbreak, then you might want to look at the contributing factors, which we call them either amplifying factors, and we're going to discuss this during the site risk assessment as well. Make sure that employee confidentiality is maintained. You are required by law to report the COVID-19 information related to individuals to local health department upon request. However, if any other party requests the medical information, it must be obtained after the employee's consent. Now you have to demonstrate that you have implemented effective policies and procedures for correcting unsafe or unhealthy conditions. Now we know that some buildings do not have the right infrastructure to mitigate most of the COVID-19 hazards, but you have to demonstrate that all efforts have been, made to reduce the risk of transmission, and you can document that in your COVID-19 prevention program. Training and instruction is very important. So first of all, you must instruct and train employees on the current COVID-19 policies and procedures, and employees must acknowledge that they've received the training. So you must find a way to document the training. You can do it either by using online platform, or you can document that using hard copies. Make the employees sign off that they've received such training, and then you can archive it and present it in case of a public health investigation on site. This training must include information regarding COVID-19 related benefits. So what are the employees entitled to on a federal and state level in the event of days away from work? The training must include the different transmission routes of COVID-19. So there are a lot of ways to demonstrate that through videos, and the science has proven that the main transmission route is person to person. It's less likely to be transmitted through surfaces, but it's still a possibility. So cleaning and disinfection must be performed frequently, in addition to frequent hand hygiene. And airborne transmission is a consideration, is one of the characteristics of this virus. So that must be included in the training as well. Infection prevention elements such as physical distancing, face coverings, which is known as source control, and hand hygiene, as mentioned, must also be instructed, and you have to reinforce that through visual reminders in your building, and through the inspection, the scheduled inspection that must be performed. Again, physical distancing, to be able to achieve physical 6 feet separation, you need to have a space which is large enough to allow this separation. When this is not possible, you have to look at other options. So telework or remote work arrangement is still one of the best way to reduce, person-to-person exposure. Reducing occupancy. So whenever your ventilation system is not supplying the minimum required amount of outdoor air, which we consider as clean air, to dilute the indoor pollutants, then reducing occupancy will allow to have more airflow per head count. So the fewer people you have in a certain environment, the more airflow per person you'll be able to achieve. Visual reminders and cues to promote physical distancing is also important. Some companies use arrows to direct the path of travel, but just let you know that passing by a person doesn't really is considered as an exposure. So a hallway is not a place where you can get an exposure unless you are lingering there and socializing with someone. So visual cues will help you define the path of travel. You have to remind people to stand 6 feet apart from each other, and will help you restrict access to outsiders to staff areas. Staggering, shifts. For example, to have fewer people working during one shift, or entering and exiting a certain location, so that you don't want everybody to leave at once or come in at once to a certain environment. So you have to stagger entrance and exit. Sometimes you need to modify a task which usually requires 2 people to work together, for example, or a group of people working together. So if you are able to modify the task without, affecting or impacting the operation, then this must be also sought. Face coverings are tightly woven fabrics, which must be worn to cover the nose and mouth. Now, according to this, under this, the standard, everybody must wear a face covering while indoors. at all time, and outdoors if they are less than 6 feet away from people. Now, there are some exceptions where if you're alone in a room and while eating and drinking at the workplace. Now, you have to know that when you take off the face covering, you are creating a respiratory risk. So when you're conducting a site risk assessment, you have to know that if that location will have people without face covering, then there's a respiratory risk, and a respiratory risk will amplify the person-to-person transmission. So you have to make sure that locations or tasks that may be conducted outdoors must be encouraged. So if you can have employees eat outdoors, if the weather conditions permit, of course. Some of them are creating tents outdoors in large facilities that we've seen, so that natural ventilation will help further dilute, any concentrations of viral particles. Employees wearing respiratory protection. If you are already under a respiratory protection program and part of your task requires that you wear a respirator, and a respirator actually gives you more protection than a face covering, then you don't have to wear the face covering unless you remove that respirator, and then you have to wear the face covering. People which have underlying medical conditions or mental health conditions or disabilities are exempt from wearing those face masks. However, those exempted employees must wear an alternative. An example of an alternative may be a face shield with a drape. We've seen a lot of school teachers do that, with speech therapy or special education, for example. If you're not allowed to, if you cannot wear a respirator, be it for, a medical condition, or your task require that your lips must be, shown and clear, then you can wear a face shield, but these face shields, special face shield, would have a drape that covers, the chin and your neck. The exempt person must be also at least 6 feet apart from all other persons, unless you are tested at least twice weekly. So if your task requires, or your medical condition requires that you cannot wear face covering, then you must be at least tested twice weekly, unless you can confirm that they are at least 6 feet apart at all times from other people. Now, on the 8th section of this of the program requires, other engineering controls, administrative controls, and person protective equipment to be implemented. Now, you have to know that engineering controls, administrative controls, and PPE are the least effective way of eliminating, a hazard. But since people are the source of the hazard and they are carrying the virus, then the best way we can do this is, again, through remote working, teleworking, or reducing the occupancy of people in a certain location to the extent feasible.
Hello.
An example
How
of
are you?
an example of an engineering control is installing cleanable solid partitions, and we've seen that in retail stores, in all reception areas where you have a lot of frequent interaction with the public. But mind you that a solid partition, which is also known as a sneeze guard, can be made of acrylic or plexiglass. It's just another surface out there, right? So you have to clean it and disinfect it. And there are no recommendations and guidance to how large or wide, this partition must be. So it's only for proximate interactions, but it's not really a typical replacement for a face covering. Another engineering control is to maximize outdoor air when weather conditions permit, and if your HVAC system and ventilation system has this feature. We've seen a lot of ventilation systems that are not economizer controlled, or you cannot override the amount of outdoor air that must be supplied to a certain location. So there are other ways to do that. And an example, if you want to supplement outdoor air, into which again is defined as clean air, you can install portable HEPA filters in a certain location. And sometimes coupling the HEPA filter with a high filter grade in your HVAC system can further help reduce pollutants. For example, Most of the HVAC systems are, they have, default at a MERV 8 rating for outdoor air. Now, the new normal is a MERV 13, according to the ASHRAE standard recommendations. So if you are able to achieve a MERV 13 rate and couple that with HEPA filter, if you cannot really maximize outdoor air in there, intake, then you are somehow resolving the solution further. Cleaning and disinfection procedures, again, even if it's less likely that people can contract the virus from surfaces, it remains a possibility. So we haven't really, when we conduct contact tracing and we see all these super spreader events, scientists have notified that, have noticed, that most of the infections occur from person to person or through airborne, transmission, but they haven't really recorded surface transmission. They've only tested the virus survivability on the surface for certain days, but no infection has been confirmed, through surface contraction. However, so you have to remain on cleaning and disinfection. Regular cleaning is recommended. Disinfection may be reinforced when in response to a COVID-19 case on site. Person protective equipment and respiratory protection are required as part of some tasks. And again, if you are asking your employees to wear, respirators, they must be compliant with your respiratory protection program according to Section 5144. So, however, you have to know that when you are wearing PPE, you're not constantly wearing, your respirator. So the moment you remove your respirator, you must wear your face covering. Now, this is, I think, one of the most important sections that most of employers, are confused with. So what do we report and what do we record? And what meets the reporting criteria and recording criteria? What is work-related and what is not? So I have a summary. One of the slides will summarize an action timeline. So when to report, and what to report and to which, authority. So you must report to the local health department your COVID-19 cases. Now we're going to discuss in a while major outbreaks and multiple outbreaks and what are the reporting timelines and criteria for those kind of outbreaks. You have to report immediately to the division any COVID-19 related serious illness or death, according to Section 330. Now, again, if you are confused to assess whether an injury is work-related, you can actually call OSHA and you tell them about the situation, and they will tell you to determine whether this is recordable or reportable. Of course, any death, anything that requires hospitalization, inpatient hospitalization, which is related to a task that's been performed during the working hours, is reportable within 8 hours of the occurrence, when the employer actually learns about the occurrence. So this is a definition of what serious injury or illness is. So it's any injury or illness occurring in a place of employment in connection with any employment that requires inpatient hospitalization. Examples would be, amputation, loss of an eye, permanent disfigurement, but it does not include any injury or illness or death caused by an accident on a public street highway, for example, unless the accident occurred in a construction zone. So they have definitions of what a serious injury or illness means and and how it can be related to work. Now, you have to maintain records of the steps taken to implement the written COVID-19 prevention program. So every effort that's been made towards drafting your program must be recorded. And this program must be accessible and made available upon request for any, by law, for any local health department or authority, and to your employees. You have to keep a record of and track all the COVID-19 cases with the necessary information. So necessary information may include, the name of the person and all the information related to that particular incident and any information that you record when you're conducting contact tracing. This is the log of work-related injuries and illnesses known as log 300. So any injury or illness that fall under the definition of serious injury or illness must be recorded on that document, even if it's COVID-19 related, and it must be reported. If it requires hospitalization or lead to death, must be reported within 8 hours of the occurrence. Now, COVID-19 cases are excluded from the workplace, cannot return until they meet the return to work criteria. So COVID-19 employees who are exposed from the workplace must quarantine for 14 days. Unless they develop symptoms during those 14 days, then the 10 days isolation period would start, and they cannot come back until they meet release from isolation criteria. So an employer shall continue and maintain an employee's earning, seniority, and all other employee rights and benefits during the days away from work if they are quarantining or isolating due to COVID-19. Now, what are the return to work criteria? At least 24 hours have passed since a fever of 104 or higher has been resolved, and without the use of fever-reducing medication. COVID-19 symptoms have improved, and at least 10 days have passed since COVID-19 symptoms first appeared. So when your isolated employee meets those criteria, then they're allowed to come back to work. COVID-19 cases who test positive but never develop, so those are the asymptomatic individuals, shall not return to work until a minimum of 10 days have passed since the date of specimen collection. And again, if in order to isolate or quarantine an employee is issued by a local state health official, the employee shall not return to work until the period of isolation or quarantining is completed or the order is lifted. And if no period has been specified, then the default will be 10 days for isolated individuals and 14 days for exposed individuals who are quarantined. Now, the third section, which are section, the third part, which are section 3205.1 and 3205.2, are related to the multiple outbreaks and major outbreaks. So a multiple COVID-19 infection or outbreak is defined when 3 or more COVID-19 cases in an exposed workplace. Again, a workplace is that microenvironment you have identified. So if you have 3 or more COVID-19 cases were exposed within 14 days in that workplace, you must report that. So upon learning of the third case, you must report that to the local health department. And this applies until no new COVID-19 cases have been detected for a period of another 14 days. COVID-19 testing shall be provided at no cost to employees during employees' working hours, and employees in the exposed workplace shall be tested and then tested again 1 week later, and it can continue on a weekly basis until you have no COVID-19 cases for 14 days. A negative test result shall not impact the duration of any quarantine. So you cannot test yourself out of quarantine. This is very important. Employers shall provide continuous COVID-19 testing of employees who remain at the workplace at least once per week, as we mentioned. Now, again, immediate investigation and determination of possible workplace-related factors. So we have to look at what may have amplified the risk of transmission, and you have to demonstrate that you have attempted to correct the hazard, and then your current policies must be updated every 30 days as the outbreak continues. So if you're still receiving, detecting COVID-19 cases on site, then you have to update your policies showing that the corrective measures that have been, implemented every 30 days. And then you have 48 hours to contact the local health department, no later than 48 hours when you learn of the 3 or more COVID-19 cases. Now, a major COVID-19 outbreak is defined as 20 or more COVID-19 cases in a exposed workplace, but within a 30-day period. So, and again, it applies until you have no new cases for 14 days. For this one in particular, you have to test twice a week or more frequently. Sometimes when you report that to your local health department, they will guide you, they will direct you to the number of testing requirements. You have to demonstrate what hazard corrections have been performed. Sometimes the recommendation is, most of the time, is to look at your ventilation. So what usually, again, amplifies the risk of transmission? Poor ventilation, not achieving physical distancing. So the person-to-person and the airborne routes are our main suspects. So you have to make sure that you have corrected the hazard. You have attempted to upgrade your HVAC system or increase filtration. And again, when you cannot do it, when you cannot, upgrade your ventilation system, then you have to look at supplemental technologies and supplemental ways to clean the indoor air, like using portable HEPA filters. You may need to enforce respiratory protection for during the outbreak, if you have major outbreaks and you want to keep people on site, so you may look at how to upgrade their respiratory protection and source control using PPE, and of course notify the local
Malek,
yes.
Sorry to chime in. We hit our 30-minute mark and then some, but I do have really good questions that I would like us to help provide some answers before we have to part our ways.
Right, sure.
Okay. The first question is, how is this different from requirements of AB 685, which is valid until next year?
So the AB 685 is a requirement that enforces the reporting of COVID-19 case. It doesn't overrule, these two standards do not overrule each other's. So this is just to reinforce reporting to OSHA, and again, most of these standards, they coexist, but they do not overrule each other. It's just a reinforcement of reporting criteria.
Got it. Our next question is, if I have 3+ COVID infections, do I have to shut down my entire workplace for 14 days until a negative test?
No. So I mean, if all you have is 3 employees, then yes, because they have to isolate. But no, when you conduct contact tracing, and all you have to do is actually report the 3 cases to the local health department, and then as we mentioned, you'll still have some employees on site, so you want to test those employees on a weekly basis until you have no COVID-19 cases for 14 days. So you don't have to shut down your business. However, if you meet the major outbreak criteria of 20 or more employees within 30 days, then maybe one of the orders of the local health department is to shut down the business to conduct further investigation.
Got it. Are there any particular screening requirements for an open workplace listed as part of this?
The screening is so they don't actually ask you to actively take temperatures, for example, but you have the screening questions of prior exposure, previous exposure within your household and outside of work, and then whether or not you are showing a list of the list of symptoms related to COVID-19. But some of the, because asymptomatic individuals do not show fever, they cannot really taking the temperature may not tell you anything. However, it is a confirmation tool of one of the symptoms. So they don't tell you what is the protocol for screening, because you can look at CDC guidance shows you in particular what the screening procedures are, and some local health department, they have some guidance documents about what could be the screening questions, whether or not you're doing the screening at home or you're doing it on premises.
Great, thank you. That's all.
If I have like one or 2 minutes, this actually summarizes the timeline of the reporting and some actions to be taken. So if you have symptoms on like day 0 or test positive, then your high risk exposure period again is 2 days prior to the symptoms or the test and 10 days after the symptoms or the test, provided that no fever and have or symptoms of your symptoms have improved. Now, if you have any illness that required hospitalization or death, then you have 8 hours to report that to OSHA. And if you have more 3 or more cases, then you have 48 hours to report that to the local health department. Your isolation ends again at 10 days, and your quarantining ends at 14 days.
Thank you. I have a last question. What are we expected to provide when contacting the county health department regarding multiple COVID positive cases in workplaces?
So after you conducted your investigation, you want to tell you give information about the individuals who actually contracted who tested positive or been diagnosed with COVID, and then your investigation includes what areas and locations and who are and how many potentially exposed individuals have been identified on site. Local health departments sometimes will contact those individuals and they tell them about their possible exposure, and they give them the order to quarantine. So this kind of information. So everything you can collect regarding the incident must be reported to the local health department.
Thank you, Malek. Are we able to get a copy of this presentation to be shared with those who attended? Because I know you had a lot of good information on some of the slides you were not able to share with us given our short time.
Absolutely, yes, definitely.
Awesome.
And if you have any questions that come to mind, then regarding risk assessment of your site, then please do not hesitate to send that over.
Awesome.
Malek, would you mind dropping your email address into the chat? Thank you, everyone, for hanging in there with us. Really good questions.
There you go.
Alrighty. Well, I think this concludes the webinar. Thank you everyone for joining. I'd like to also point out that next week we have a webinar on social media branding. So you'll definitely want to join us, and feel free to reach out to myself if you need any registration help. All right.
Thank you, Malek.
Thank you.
All right, bye.